Thank you very much. And thank you first, the organizing committee, for inviting me to talk. And as you see, my gender is significantly different than the gender of the other speakers. And my talk will also be significantly different. I will only have one survival curve, but I hope to inspire you a little bit about this subject on internet use and virtual reality in patient care. So you might want to think, like, what has this to do with acute heart failure? And I will tell you. We can pump and clip and medicate our patients, but if the patients will not take the medication, they will die anyway. So that's what I really want to stress here, that we have to focus on other stuff, on other issues in patient management too. And this is already old data, but if we look at it nowadays, it's the same, that non-compliance, non-adherence in patients is an important reason for readmission with acute heart failure. Other things, inadequate medical treatment is something we can change. Infection, uncontrolled hypertension, these are all causes for acute heart failure, and we need to get in shape with our medical and follow-up management. So actually this slide I got from the previous president of the Heart Failure Association, and he would say, Stefan Anker would say, the best drug cannot work when it's not prescribed. And of course, that makes all sense to us, but we often don't think about it in daily practice. So in this study that has been published already some years ago, we can see that if people have an ideal prescription of guideline-based therapy, they will have less hospitalizations and for heart failure or cardiovascular causes. And if they have poor prescription, so I'm talking about prescriber adherence by cardiologists, they will have worse heart failure outcomes. And in that study reported by Komagia and his colleagues, they said overall physician adherence to ESC guideline was 63%, which we think, well, it's quite okay. But it means that 37% of our patients will not get enough medication according to the guidelines. And they also concluded that it was related to hospitalization and time to hospitalization. So that is about our physicians, healthcare providers prescribing medication. How about patients? The best drugs can also not work when it's not taken. Of course, that also makes sense to us, but we know, and this is my only survival curve I will have, is that patients that have a low compliance will do much worse than people who have a good adherence to the medication. And of course that makes sense because that's why we prescribe them. But we don't always think that a lot of people don't take the medication. And this is actually a slide that we made by using this medication event monitoring system, which is a pill bottle with a chip in the cap. And every time the pill bottle gets opened, it's registered it in the chip, and we download it to the computer. And if we have a patient who needs to have an ACE inhibitor once a day, like here, and this patient you could see, he opens the bottle every day at 7, a little bit later than 7, and is very compliant during the time. But this is also a patient from our real world. And if you can see here, sorry for that, these patients will have 0% of days that he correctly takes the medication. Some days he would take, and I can say it's a he because here it says man, but this patient is supposed to take an ACE inhibitor twice a day, and he does not take it. And this is the real life what we see. And also other parts of our management. For example, this is a study that we did in Groningen in the Netherlands, where we looked at how many aspects of the non-pharmacological therapy are patient compliant with: diet, fluid, exercise, and weighing. And you could see that people, if they have like only compliant with one or two aspects, they had a rehospitalization rate of over 40%, and they had even 25% if they were compliant with all aspects. So not only medication, but also other lifestyle advices. So the keys to success that we've been all talking about today, I think, is that providers need to prescribe correctly, and patients need to adhere, comply, or take the medication correctly. And then we come to the guideline adherence. We need, as professionals, adequate, up-to-date knowledge, skills, and also tools that help us to make the right decision and to do good prescription. And on the patient side, patients need to be adherent to the treatment. They also need knowledge, not only knowledge, but also skills, and they also need tools. And there my title of the talks finally comes in. I think that we, of course, think about the brochures and the face-to-face counseling and the physicians and the nurses, but really I would like to open your mind a little bit for internet and virtual reality. So the goal of my presentation is to inspire you a little, to open your mind, to take away some of the hurdles we think about internet and virtual reality. It's not for our patients, but maybe also bring in a few new hurdles, but especially to inspire you today. So what about internet use? Internet, of course, has been hugely, it's grown hugely in the world, and you can see here that in some countries almost everybody has access to internet. And just to focus on that a little bit here, you could see in Israel the access to internet is 74% of the patient has access to internet. Don't ask me what they do with it, of course, but they have access to it. So if we want to use it in patient education, it could be something that we can use, and we often say, well, our patients don't have access to internet. It's not always true. Here is Poland, Piotr, and this is the part of the world where I come from, Sweden. We have a very high internet access there, and also in the Netherlands. So some changes, differences there, but still. Then a little bit about virtual reality. Virtual reality is a computer simulated environment that can simulate physical presence in places in the real world, as well as imaginary worlds. And then you have this whole new thing about serious games that also seems a little bit go away from the medical world, but it's games to serve purposes like education, training, advertising, research, and health. And to go back on the virtual reality, a lot of you probably been in the army and used maybe flight simulators. This is a simulator that they use to train when parachutes land. But also, maybe less advanced, is the virtual walk in the woods that people can take. And this, of course, is our matrix idea about virtual reality, that people with the glove even can lift very heavy loads by using virtual reality solutions. So how to use that? I will talk about that. First, about the professionals, us. How can we use these new features? I think we can use it a lot for knowledge transfer, skill building, and to stay up to date. And I will go a little bit into that. So to knowledge transfer, and I know a lot of you work hard in daily care, in emergency rooms, in surgery theaters, and at the wards. But our younger generation physicians and nurses and healthcare professionals, they are used to more like internet, interactive learning, and we have, of course, still the books of Brownwold in our possession, but still a lot of us are used to learn now from the internet. So we have to also keep that in mind if we want to train our staff. Skill building, that we can learn internet, or use internet and virtual reality to build skills, to learn, practice. Simulation is used a lot now in medical schools, but also teams, for example, from the hospital I work with, are training with the emergency staff. They go one day in the simulation lab and use that not only to use their skills, but also how do we communicate in the emergency room? What happened? Why did this go wrong? And also to stay up to date. The guidelines, the publications, they're not only in print anymore, but we can use them on apps and we can get them from internet. So a few slides on that this is about a very recent slide about physician use of smartphones for professional purposes over time. it's increasing, and well, like 3 out of 4 use it actually also for professional purposes. This I would like to bring to your mind. You all have it already on your apps or on your phones or tablets, of course, like all these professional journals that you can get access to and easily get up to date. And this is one I find. I'm not sponsored by any of these companies, I have to say, but this was, I think, a cool app also that you can have, like a heart failure trials app, which updates you on that. This is what a lot of us use, the Medscape or the heart.org. And actually there are some studies, not like the big trials yet, but also in this way of learning and using new skill builders, there is also research. And this is a small study on, can people use their skills, or can they learn from the web as they could learn in like our normal face-to-face tutoring. And this is a small study, very small, but they show that people using the web or using the didactic group approach had the same scores on tests. They had also the same skills. Other things I would like to bring to your mind is that there are other ways of learning. For example, this is a game that they use to help people learn what they do in triage. So not actually doing it, but what happens in your head. How do you make choices, or maybe procedures? And this is like games that you can buy or you can use to build skills. And this is some other fancy equipment to use to learn skills. And for the surgeons also the Touch Surgery app, and actually they've done some studies on that students that practice with this app were better in performing their exams than the students who did not use that app. But of course there's always a but, and this is a good also to know that this group looked at all kind of cardiac auscultation material on YouTube, which our students, of course, also use. And they are a little bit more cautious and skeptical on that, and they did an analysis of these kind of movies, and they conclude that given the lack of regulation of these videos, it's likely that the proportion of online resources are still of poor quality, with substantial educational flaws. So we have to be not only be very optimistic, but also be critical on what people learn and if this is the best way. But they can also conclude that utilization for education, continued assessment of content is required. So there is a future, but we have to be a little cautious. You could also blog, of course, with your patients. But what I wanted to draw your attention to, and I know this is a bit busy slide, but just to have to look at this publication from 2013, where they actually give very good advices how you can use it, what are advantages, disadvantages. But this I want to draw your attention to recommended safeguards. Because we easily adopt all this new stuff and it's great, but there are some safeguards I think you have to be aware of, and I took a few of them and put them on this slide. That, for example, if you email with your patients, that there should be guidelines in the ward or in your clinic. Where do you use the email for? How to chart the email. If you email and adapt doses of medication, where is that? Is this only in your email box? What will happen if something happens to the patient? So to have some guidelines, and also to they recommend that only to have this digital communication if you really know the patient, so if you have face-to-face contact. This is what we have in our clinic, also make a list of recommended sites that patients can visit. They visit websites, but if you can give them a list of sites that you have scrutinized and think this is a good site you can learn from, it can help them to find their way in the jungle of internet. Blogs, that if you want to blog, pause before posting, think about it. I think it's with everything in life, and social media to really maintain separate personas. So if people want to use Facebook to communicate with their patients, not to mix it up with their communication with the children and grandchildren. So that brings me actually to another key part of success is that the patient adherence. And that's really my field of expertise, to do research on that. How can we make people buy into the things we think are important for them? And it is very important to do that, because we always think, okay, our patients do fine. And we actually did a big survey where we looked at self-care behaviors of heart failure patients in 15 countries worldwide. So it's not only an American or European view. And there we collected also here in Israel on self-care with the self-care behavior scale. And thanks, Vicky, for collecting the Israeli data. Where we saw, and here the bars are worst behavior. So this is low self-care behavior. And you can see through all countries is a lot of people who had low self-care behavior with regard to diet, exercise, weighing, taking the flu shot, or medication. And I will not go into that, but just to see this is a worldwide problem. And here I also think from the patient side, we can use a lot with internet and virtual reality. For example, education sites, tools for monitoring, telemonitoring, and the next speaker will talk about that. But also apps to learn about diet, exercise symptoms, Facebook, and games. This is a site you, of course, know very well because it's heartfailuematters.org, and it's a beautiful site. I like it a lot, but I have to develop, so I'm a little biased there. But this is a site, and although it's not in Hebrew, it's not in Swedish either, but we have a lot of patients that ask us about sites. And this is actually the site that has been made based on the ESC guidelines, with several translations also. And, sorry. See what I did here. Yeah. So here, for example, what can your doctor do? What can you do? Living with heart failure, etc. And it has like a virtual guide, and so with warning signs, people can learn about that. I like this a lot. Like you could even, if you don't want to use the whole site, you could use like these animated journeys through the heart if you want to explain about an ICD or CRT. So you could use it or give it to the patient and say, next time if you have watched the video, you can talk to me about it. The nice thing is that it is translated in a lot of languages, and this is the Russian version. So even if you have patients, you don't have patient material for in their own language or from your clinic, you can get them to the site. They have also nice charts and tools. So then I come to tools. It's not only about education, because we know that, of course, that if you only tell, people will not do. People need tools. They need to have charts where they can sign their weight and their blood pressure, etc. And there's more. There's more medication trackers that we can help people how to remember to take the medication, how to remember to weigh yourself daily, etc. And this is a study that's just presented, and I'm waiting for the real publication that they have to help people recognize symptoms in heart failure. Well, that's exciting. This is in Dutch, but this is a patient who came to my Facebook before I realized that I needed to have different personas. And he is on the Facebook and then saying, like, I did this and I did that. Although I don't want to know this personally, I could imagine that if you work and you want to have people motivated, this might be something to motivate. And here he would say, I walked 3.6 kilometers in 59 minutes and burned so many calories. And then you could give like a like or say, go on, etc. And there's like YouTube, of course. But I want to spend my last slides on game computers. And this is something we don't often have in our minds and think, well, you know, I have older heart failure patients. They are not interested in game computers. Well, I surprise you, they are. And these are a few game computers that are used in rehabilitation, the so-called reha games. So you have the Nintendo Wii, I will talk about that later. You have a virtual walk where people have like a walk through the woods or their old environment where they used to grow up, and they can walk on a treadmill and walk through the environment. For just like limb therapy, you have robotic therapy, memory games, but also the virtual shopping mall. And this is not only for women, it's also very good for people to use. They use this. This is actually developed in here in Israel to take what's good food and not, where to shop, and people could help to find healthy food. And then I will come to the Wii. The Wii game computer is a computer that is used a lot by children, but we now use it also in a study, a randomized study. It's called the Heart Failure Wii trial, and we now started data collecting in Sweden in 4 sites, and we start soon in Italy and also in Rabin Medical Center here, where people will be randomized to have structured access and instruction and counseling about using the Wii Nintendo game computer to get more active, to get bowling and tennising with a game computer. And we have other people will get only motivational support and not access to the game computer. And these are some slides we have from our training sessions. Here you can see the heart failure nurses. This is our instructor. This is a patient who tried to, and instructor to use the game. So in conclusion, I hope to open your mind a little bit on to say like internet and virtual reality are the future, but actually they are the now. Our generations are working with it. It's not something that's happened in the future. I think the role for professionals is that we really get our act together and get adherent to guidelines. And we need to be open on new applications like apps or tools that help us to also build in safeguards and also make a policy on our daily practice. Then for the patients, there we have to constantly work on adherence to the treatment. And there I come back to the professionals. What do we need to help our patients to adhere? It's also an open mind for input from patients. We are now in the Google generation. People will come to you with what they found on the internet. So we have to be creative and use it in our education. Also discuss policy. How will we deal with that in our daily practice? And look for new solutions for all problems, because non-adherence has been there. We have to look for new solutions. And with that, I would like to thank you for your attention.
Thank you very much. Professor Rosesman, please.
I think that's one of the most exciting lectures that I've heard from many years. I think all our patients know is the internet. I think I don't know where we got the number 68% from. All my family comes, my great-grandchildren use the internet. So the question I really want to ask is how do you use virtual reality?
How you use virtual reality? Well, for example, this Wii bowling game, we use the virtual reality, like people feel that they have the bowling ball. They don't have the bowling ball, so they have to do like throw the ball, and then on the TV the ball will the pins will fall. And you can also do with the tennis. So it's not really that they really tennis. They are in their own home and then they tennis. So that's how we use the virtual reality with the patients. Sorry?
They're using their own physiotherapy at home.
Yes.
They're reducing their depression. We heard this morning about depression at the bottom of one of the slides. They're removing depression.
Exactly. Yes. Thank you.
Thank you. Thank you very much. Very inspiring lecture, very futuristic. I have no questions. I learned also once again. I would like to have a private discussion with you. Maybe I can be involved in one of this kind of a trials as an instructor to train myself. Anyway, thank you very much.
Thank you.
And then